Thank you very much for attending this session. Uh, my- I am Vasanthi Rao. I work for the Child Development Research Center at the University of South Carolina. I work primarily with the Division of Early Care and Education at DSS on a grant to analyze the data and basically policy research. Today, we're going to be talking about geographical equity in childcare. Geography is extremely important in equity. We are extending an index that was developed by the Center for Disease Control and Prevention called the SVI, Social Vulnerability Index. I'll be throwing out a lot of acronyms. So hopefully I will remember to explain what every one of those acronyms are. What I'm going to be presenting is an extension of the SVI to look at the geographical equity. So let's start by defining equity. Equity is defined, I love this definition that I first heard it at a presentation at Child Trends. This is something that they have adapted. You see also the source for this definition. It is both a process and an outcome. As a process, it is defined as equity is applied when the people who are most impacted by decisions are involved in the decision making. And as an outcome, it is defined as a condition we will achieve when personal characteristics outside our control no longer predict how we fare. So you see the personal characteristics that are listed out there. For example, our race, ethnicity, gender, sexual orientation, ability status, religion, age, and class. To this list of personal characteristics, I am adding geography. Where children live, the neighborhood that they come from should not predict how well they do in their life. And as you heard in the plenary section today, Dr. Navsaria said, a child's zip code is a greater determinant of their success than even their genetic code. And that is what we are addressing here when we're talking about the geographical equity. I'll move quickly through the slides and hopefully we'll have some time for discussion. So the equity index, we use 3 indicators. As I said, this is an extension of an index that was developed by the Center for Disease Control, Social Vulnerability Index. That's the first one that we used. And a lot of states have been using this in early child care, in the early child care field. You'll have some, I will share the slides with you, and you should have some links to what the social vulnerability index is. It's basically a community's ability to respond to a disaster, such as a hurricane. That is why the index was developed. What we have done is, these are the indicators that go into the index, and as you can see, some indicators are relevant to early childhood, some are not. So what we have done is we have placed this index, we have created an extension of this index in the early childhood field, for the early childhood field in the context specifically of childcare. We are simply calling it equity index. We may come up with a better name later. So the extension adds 2 more indicators. One is a licensing capacity indicator, which is what is this, does a county, and these indices are at the county level. I'll talk about a deeper dive later. So these are the county level. The licensing capacity of a county is the maximum capacity in childcare to meet the demand within the childcare. As you can see, the areas that are blue have a very high maximum capacity. And the areas that are darker orange do not have as much capacity to meet the demand. We'll go into how supply was calculated, how demand was calculated when we look at the maps. And then the second one is, where are the children who are living below children under 5 living below poverty. That is the third indicator. And we'll also look at the next level of analysis. All this is at the county level. As Dr. Navsaria said, there are 3 tiered intervention. You want to start off at the higher level at the county level, and then you have a drill down analysis. So let's actually look at the maps, because I think you're here to see the maps. Tell me if you can see this map. Somebody who's monitoring, can you see the equity index on my browser?
We can see equity index with a picture of children holding the.
Oh, thank you. Thank you. So this is basically a description of what I just said. These are the 3 indicators. We put them together to create an equity index. So this map is a combination of the 3 index. You can get, every county can get a score of anywhere between 1 and 4 on the 3 indicators. So the maximum score showing that they're highly vulnerable is F4, and the minimum score is 1. So you see these areas are highly vulnerable that are 4, and the ones that are 1 are the least vulnerable. We moved away from simplifying something as a urban and rural, because what we have, urban and rural definition, the reason it is too simplistic and sometimes may be misleading is when an area like Charleston, it's based basically on the number of people living on a certain square footage of land. So people who are, if when Charleston gets too expensive, so the people move out of Charleston and live in the county nearby, and that becomes urban because the number of people living there are urban. And if your focus is only to do like a rural intervention, you may miss that. You may miss that area. So we moved away from the urban rural, and this is a composite. Let's look at the social vulnerability index. These were numbers that were created by CDC based on all the 16 factors that you saw. And we always see the I-95 corridor show up as being extremely vulnerable. So, for example, let's take Marlborough. It's got a 4. I think this is Marlborough, right? No, that's Chesterfield. Yes, it's got a 4. But the total rank that Marlborough got was 12. When we give the most vulnerable as a 4, the next set of counties 3, 2, and 1, Marlborough scored a 4, being highly vulnerable in the social vulnerability index. The lack of ability to meet the childcare demand within the county, it's also scored a 4 on that. And it also scored on a 4 on the number of children, the percentage of children. You see Marlborough scored a 4, and the percentage of children who are in poverty in Marlborough, it scored a 4. So totally it scored on the 3 indices, the total score was at 12. And therefore, when you look at the equity index, so Marlborough scored a 4 as being highly vulnerable. I'm going to stop here and see if anybody has any questions for me.
Will we get your PowerPoint or information how to get into this link? Go to USC?
Yes, I can share. I can share. I can share the information. I'll share the PowerPoint, and I'll also share the link to the maps in the PowerPoint. Sure, sure. Anybody else has any questions?
Everybody seems excited and want you continue.
Okay, let me actually continue talk about one thing that I skipped over to make sure that we had enough time for discussion. So when I say the next level analysis, right? And oftentimes when you're in these areas, and I once got a call from somebody who was applying for a grant and she said, Vasanthi, all the numbers look so good in my county, but we know right in our backyard there's so much there's such a need, and we see these pockets of poverty that is totally getting obscured, because when you look at the county at the aggregate level, the number of the wealth in the county is hiding those areas of poverty. So the what I presented right now over here with these maps is a first level to look at vulnerability, but we're not stopping there. And this is not just going to be a guiding. This is not just going to guide us to the next level. For example, we're not only going to look at the areas that are marked for, there are pockets of poverty we know in North Charleston, right? So that is going to be our next level analysis, which is not at the county level, but which is at the zip code or the census tract level. And it is also not just, these are all artificial boundaries, whether it's a census tract or a county. We know if we, that the neighboring areas where we see certain vulnerable areas also need intervention. So the next level analysis is going to be a deep down deep dive looking at children under 5 who are living in poverty. We have several sources of information that we have used to identify these areas. Then we overlay the childcare centers that they have access to, or lack of childcare centers that these children have access to. We look at what other resources are out there, and we hope we share this with policymakers so they can use that for their policy decisions. I'm not able to monitor the chat. If there are any questions or comments, please let me know.
No question yet. This is Sherry. Hi.
Hi, Sherry.
Vasanthi, I have a question.
Yes.
When you collect, where you get your data from the DSS about the poverty, or how many the subject actually involved in this database?
So that's a really good question. We try to triangulate data from more than one source, right? So with the social vulnerability index, you see what the CDC has done. They didn't just pick one indicator, right? They pick 16 different indicators, because a combination of these indicators would show that a place is a very vulnerable or not. So when we looked at licensing capacity for the supply of childcare, we're looking at supply. Does this county have enough supply to meet the demand? For the supply, we looked at the licensing maximum capacity, because right now the agency is actively collecting enrollment data. That is true supply, but we don't have that. So we were using maximum childcare capacity within the providers. And when it comes to the demand, what we did was we used the number of children born in a county. We know some people move out and some people move in, but we used the DHEC data to see how many children were born in Marlborough last year. So how many 1-year-olds do we have? How many 2-year-olds do we have? If we have 1-year-olds, do we have infant capacity? So that's where we used the birth certificate data, the birth tables data. And for poverty, it was very interesting. We have census data for poverty, and but we use once again the birth tables data to see how many children's birth was paid for by Medicaid, because the parents meet that income threshold, low income threshold, so that their birth was paid for Medicaid. So that also although we had two sources, when we compared to see which one that they both say the same story, we picked the DHEC data for poverty as well.
Thank
Good
you.
question. Thank you. And I'll say this is we are hoping, like you see over here, that there are a lot of counties that have a high capacity, right? The childcare capacity is high. So sometimes it is not the question of, oh, there's a lack of childcare, there's a lack of uh, you know access to childcare. It's not to add more childcare centers. Sometimes it is an optimal use of the childcare facilities that we already have. Are these childcare facilities really performing at are performing at the maximum capacity? That are they serving the number of children that the licensing regulations say they could serve? So it sometimes we like to say, oh, there's no childcare, let's increase childcare, or like let's increase supply. But there are so many different solutions to the issue. So just letting you know that it's not as simple as just is there childcare or not. And the policymakers, how the index that is going to be used um, is the areas that are highly vulnerable are going to get more resources. So if you think of a policymaker, they have limited resources, right? So they're going to target areas that are more vulnerable.
Do
Okay.
you mind going back to the one that shows the percentage of like the availability of childcare, the
Sure.
previous slide? And I'm interested in the Barnwell, Bamberg, and Allendale County information, which I'm assuming is probably that there, kind of that.
So that is very interesting. You say Bamberg and Marlborough were the most vulnerable, right? So when let me, can you still see it?
I can.
Yeah, yeah.
And so
Licensing capacity is not the most ideal way to measure supply, but that's the best we can do with the data we have.
okay.
Sorry, go ahead.
And my concern was I know that we don't have in Barnwell, Bamberg, or Allendale area, we don't have hospitals where children are born. And so
Yeah.
I don't know how that data pulls. And our nearest kind of, NICU or specialty hospital would be Augusta, Georgia, which would then be out of state. And so I know that our data is very difficult to capture because of that dynamic. And so it's just interesting to see kind of where those numbers were
Yes.
derived from.
So when I started using the data, the first thing I did was I worked very closely with DHEC on understanding the data that I'm using. And the the birth tables data is based on the zip code of the mother's residence. Zip code. That's what it's used. So they could have the child anywhere, but their residence, their address of the mother and the zip code is what is used to count the child. So somebody who you said, did you say Bamberg? So somebody could have a child. So all the hospitals, they could come to Lexington, Richland and have their children, but the mother's address and the zip code is what determines where the child is counted, which county the child is counted. So it does not matter if they have even out of state.
Okay, thank you. And
But
so Bamberg is the 72%.
Is this okay? I'm going to go back to my
Bamberg
map.
or Avondale, I'm sorry.
Yes. So I'm going to go back to my map because I think this is Bamberg. Am I right? Oh, that's
It's
Barnwell. Sorry. Where I
So
usually
Bamberg
have.
would be there, like the 3 to the right is probably Bamberg.
Is this
And then that's probably Allendale.
okay? And this is Bamberg, right?
Yes.
Oh, finally got it. So it's totally score. The total score in Bamberg was 8. So this is, I'm glad you asked this question because when you look at Bamberg, right? So it scored an 8 because let's look at Bamberg and the social vulnerability was a 4. And it is 1 in childcare availability. So it has a pretty good, then enough childcare centers and a 3 here. So that's why it's scored an 8. The number of children living under 5 living in poverty, it's scored a 3 on that. So it is all, let me also say this, it's relative, right? What we did is we sorted the data on, let's say, childcare availability, and it showed like 72%, right? So 72% is that good enough? And oh, I have to also say this: it's not all children. We know that all children are not looking for childcare in a county. We use the percentage 64% of children in a county as the estimated demand. The reason for that is one of the census data, it was the 2019 ACS data, showed us that 64% of the children live in households where both parents are working. We said that is a good estimate to use for those are the ones who need childcare. So when you look at it, 70, did it say 72, 73%? So it had a high percentage of, like you see, it was, isn't Bamberg 147%? Right there, right?
Yes.
So it has a lot of capacity. We don't know how about the enrollment, but it has a lot of childcare capacity, and that's why it scored 1 when it came to childcare availability.
For something, can you see the question in the chat?
I cannot see the question.
Okay.
I am okay. I'm going to.
Carolyn
Yes,
asked, do you evaluate the availability of high quality childcare?
That is a good question. At this level, we do not evaluate. So like I said, we are doing a deeper dive where we look at only childcare center availability who are in ABC quality. The reason for that analysis is because if somebody has a voucher, they're approved for childcare subsidy, they can only go to an ABC quality facility. So that's a different analysis that we have done for the division to only look at quality childcare.
Amanda asked, in terms of capacity, do you have any data on childcare centers that are not able to serve their capacity because of lack of employees?
Very good question. I would definitely, there are several reasons why they're not able to serve for their full capacity. So when we visited childcare centers and we tried to do a ratio or just a sample to see if this is your capacity is 100 and you're serving, let's say 40 children, and you're not serving 60, what is the reason? Is it a workforce? Is you don't have enough employees? Or is it because a lot of those areas were like a gym, or they were in between those classrooms where it was the cafeteria, right? So where they can technically have children, but they don't have children. So we tried to figure it out. I would say we did not get good data on it. So therefore, in the next few days, you'll be hearing about the stabilization grant. There's going to be a very big push from DSS to get enrollment data, not just capacity, and to see how they can help childcare providers to serve the full capacity, whether it is additional staff or other resources they need. You're going to hear very soon from that. I hope all of you have got the invite to the town hall meeting to learn more about that. And that is where I would address your concerns, because there is going to be, I think there are going to be resources available to maximize your enrollment to the capacity.
Thank you.
Sure. I don't even have track of the time. So let me know if when
you have 6 more minutes.
I have 6 more minutes. Okay.
That's all. Sorry.
No, that's
Cassie's
good.
back, so she can help you.
So yes, if anybody has any more questions, let me know. We are excited because every time we present, we work with the policymakers, right? We present data, we write up reports. Nothing has been as powerful as the maps to motivate action, right? Of course, these maps come at a great time when there is the stabilization grants and there are resources available through federal money to be able to act, right? We're in an unprecedented time where we do have a lot of resources available. So we're excited that the maps are going to be used and have been used quite a bit. And I hope we can share more maps and add more layers to show where are the industries and where are the hospitals and where are parks and those kind of things, so that all of you should be able to play with some interactive maps and use it in whatever work you do. Okay, I am going to stop sharing at this point. Well, thank you, everybody. Thanks for.
You can see us now.
Good to see you. Yes, I was driving blind.
That's
We had
okay.
a-
I'm
we had a lot-
really interested. So we can download these informations at USC or CCRC website? No?
No, I should be able to put it. Let me show. I'm going
Can you
to.
put it in the chat for us so this map will really make a big impact for me to see, especially I have several areas so I know their resource need. And today we have a session networking. I don't know about anybody else, but Dion, am I right? I was with her with different people. I learned more resource has been created. And one is Health Family in America. They do a lot of family visit. They bring the resource, help them the rent, utility. They even have give the resource about where to help parents get the furniture. So it was amazing. And this map, this research we're doing will really help, especially those policymakers, to make sure the equity is all around the state, not just
Yes.
county has so many resources, but those most needy area, they need more.
Yes, they need a lot more. It's not equal, but to provide resources that are needed.
Oh, can I say
what I have done is I've given you a link to our website.
Yes.
So to our childcare research team website, and we will have a link to the slides and the map on that website. Currently, it has only the workforce study that we did in 2018. It has results from that, and but yes, please go to our website. You should be able to download the PowerPoint slides. Okay.
That's great.
Thank you for this presentation. It's been great.
Thank you. Thanks for attending. Thanks for your interest.
Just as a comment, I serve on school board as well for Williston 29. And one of the things we run into in teacher recruitment issues is we don't have adequate childcare already in Barnwell County. And so when you have educators who are coming to work, and we're kind of 30 minutes or an hour from everywhere. And so most new parents don't want to have that child that far away in childcare. And so we really run into recruitment issues where, again, we're not getting parenting educators because of that lack of childcare. So it's good to see this type of data to be able to actually show, just show that those are things that impact systemically the education process. I really enjoyed the presentation.
Oh, thank you. Thank you. We were also considering putting childcare centers up there, like not just say what is the capacity is it, is it 120 or, whatever a number, but actually plotting the childcare centers. The reason we did not do it at this point is this keeps changing. Mm-hmm. And we wanted this map, and we have to keep updating it. We wanted this map to be as, it's a big picture. It's at the, like I said, it's the tier 1 map. So without going, but hopefully we'll be able to share, so you could actually go and zoom into Barnwell and say, this is where childcare is. We don't have childcare. You should be able to do that. But thank you.
Well, in our very rural community, this is more resourceful than you already know. It's a starting point to be considered at the table, just kind of as a entirety with the state. So I really appreciated having this information.
Thank you.
Santi always do great research, very thorough research. I'm from South Carolina Resource Referral, not because she is our boss, but she really do a lot of good research that help us to understand more and better. And right now, we just want to do more to spread to the policymakers so they understand why it's so important about this research.
Certainly.
Data visualization is powerful. A picture speaks is worth 1,000 words, right?
Yeah.
So, and what Dr. Navsaria said this morning really resonated. I've written it down, where a child's zip code should not determine their outcome.
Yes.
Exactly.
Right? That should not be so, and that's where we need to put in all our resources. That's why we call it geographical equity. But thank you all for your interest. If you have any questions, I'm going to put my email, and please contact me. Okay. Thanks.
Thank you. Have a great day. See you tomorrow, everybody else.
Bye.